Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day we are interviewing consequential leaders in the battle against the coronavirus. We've heard a lot about the plight of hard-hit urban hospitals and the struggles to secure PPE and ventilators, doctors and nurses working round the clock to handle overwhelming patient loads during this pandemic. But one facet of healthcare that we've heard less about is the plight of rural hospitals. The number of patients may not be as great, but the challenges are there. Rural hospitals were already on the ropes, and now much-needed revenue just isn't coming in as patients are visiting doctors less frequently and so-called elective procedures are on hold. My next guest has been unyielding in his support for rural hospitals. A doctor himself, he's also a congressman from Ohio's 2nd Congressional District. Congressman Brad Wenstrup recently requested that rural hospitals be eligible to participate in the Paycheck Protection Program and other financial programs provided by the CARES Act. He's also been a vocal advocate of convalescent COVID patients' plasma donations. Congressman, thank you so much for joining me. I have been watching your comments about rural hospitals, what's happening or concern for them. Can you give us a snapshot of what's happening on that front and why you are a bit alarmed?
Well, one of the things that you already mentioned is our rural hospitals already have a difficult time maintaining enough revenue to keep themselves open. And this has not helped. And canceling the elective surgeries and cutting down on emergency room visits really made a negative impact on our rural hospitals. So we've been fighting to get more funding to go to the rural hospitals so that they can sustain themselves through this process. The elective procedure part was a main thing. And the reason those cases were canceled was because of the concern for a lack of supply. And as supply builds up, we've got to get those reopened. Plus, there was a little bit of hesitation I found on some of our rural hospitals to go ahead and do some procedures. And so what I was concerned about, Steve, was we were canceling surgeries for patients that were in a lot of pain, but it wasn't necessarily life or death. We were canceling biopsies for cancer patients, and we needed to get that back open. And I actually reached out to our governor to try and get the word out that these aren't the types of cases we need to be canceling. But the problem is they are down. We need to get those back. The sooner we get those back, the better. And I think that there's good procedures in place now to safely open that up and go ahead and start performing some of these procedures.
Now, is that process going to be part of the reopening of the broader Ohio economy? There's been a lot of discussion about how to get the equities right between public health and getting the economy moving forward. Do you put some of the rural hospital activity in that as well?
Yeah, I think that's a double priority, if you will. One is to provide the health care that people need. You can only let some things go so long before there's other side effects that you really don't want to see happen, such as we've seen an increase in suicides. We've seen an increase in domestic violence because people are quarantined. So these types of things end up needing more hospital care, unfortunately. And we've got to get this open and running. And I think that everyone recognizes that the benefits are worth the risk. And actually, the risks are a whole lot less at this point because the supply of PPE has come in. The ability to test more people as we go and to protect our healthcare workers is there as well.
Now, Brad, you've also been a real champion of trying to get people that have been infected with COVID and have recovered to donate their plasma so that other patients that are fighting this disease right now, have greater, they've got more internal wherewithal to fight this disease. I'm interested in your leadership on that and how that's going.
Well, I've done some public service announcements about it, trying to get it out to the local community, Steve, because it is important. It's an area of hope that really hasn't been discussed much. I was pleased to see that 60 Minutes talked about it last night when they were reporting on the situation in New York. But basically, when someone has had this, whether they were really sick or not very sick, they have produced antibodies against this virus. And this is not some type of new science. This is something that the FDA is behind as well. But it is something that is used, say, with measles and mumps, and the acceptance of this type of procedure is there. The results remain to be seen until we get this in place. So I'm really encouraging people that have had it to be a hero, step out, give plasma, and you may save a life along the way. And what we're finding is that you can get it to somebody before they need a ventilator. And before they really get too sick, it can have a greater benefit. But we would use it on severe patients as well as those that are less severe. And so there are markers that you can see if a patient is starting to crash. But the key is the supply is the key. And you've got to get people out there that are donating. So talk to your doctors. We want to reach out to the doctors that have COVID patients to make sure they're tracking them
Right.
and get them in line to make this donation, which is life-saving.
Well, let me ask you one more thing on that, because I interviewed Mayor Francis Suarez, the mayor of Miami, and he donated. He had COVID, and he donated his plasma for this. I haven't seen any research results yet. Have you been in touch with the FDA about whether this strategy is actually working at all?
Well, Mount Sinai was one of the first in New York to use this, and they have seen positive results. Again, we're going to find out who it works on best, but certainly be able to use it. The more we're able to use it, the more we can get results and get data. But it is in the early stages, and we're just coming into the phase where there's a lot of people that have had it that are now clear to the infection, which is key. You've got to be clear to the infection, and you still do a type and cross. You need type A, type B, A, B, and O. You need all of those. And so it's going to be a little time before we see a lot of results. But again, donate and we'll start to see results. But now is the time when a lot of people have recovered and are in that safe window to donate.
Now, we have about, at this moment, when I'm talking to you, about 765,000 official cases of COVID in the United States, and that's more than 3.5 times the next biggest country, which right now is Spain. Who knows where China really is, but it says it's around 80,000. But I think in the process of this, you've been very critical of how we got into this mess and who was culpable on the front end. What are your thoughts there?
Well, I have a large concern about honesty in the reporting of data, et cetera. I was on Cincinnati Board of Health, and we never had anything of this scale, as you might imagine. But it was always important that when we did see outbreaks of something, that we get accurate data. So the question involving China is there, and then the response of the World Health Organization. Where are they? This is an agency that needs to be super transparent and very much out there with accurate data if everyone's going to make good decisions. And keep in mind, the World Health Organization was against the restriction of travel at one point. The World Health Organization said you can't get it from human to human contact. And we now know that you can, and that we should have restricted travel. And I'm glad that we did, because it might have been a whole lot worse. So if we're paying money into this type of an agency, we better know that they're doing things right, or we find another way to do it, because lives depend on it. And it's not about politics. This has to be very upfront, and everybody has to be good, honest brokers that are involved with this along the way. You know, I worry about the communist system, because if you watch the documentary Chernobyl, which was very good, by the way, the bottom line there with the Soviet Union at the time is it's not a lie if it benefits the state. And that's my concern with China right now. We've got to have open and honest transparency when it comes to the data if we're going to make good decisions, and also be able to share our intellect. To be able to share our intellect freely of what we know about a disease and how it's acting and what's working and what's not working.
Right. I have gone back to read those WHO reports, and they certainly did not say to restrict travel. They certainly did not, issue some of the guidelines that I think President Trump jumped on at that moment. But we had our own internal analyses of things that were going on. Are you worried at all about the breakdown of our intelligence and the way our system operated, separate from the WHO? I mean, we had lots of internal red flags going and saying, there's something bad going on here and we need to do something about it. But at the same time, we told, don't worry, it's over there, it's not here. I'm just interested what self-criticism we need to look at to get it right inside the United States.
Well, part of it is that we have to realize how small a world it is today, and that international travel is so abundant, and that the world is a smaller place. And if you look at some of the previous viruses, some did stay pretty well contained in certain areas, and that's certainly what you're after. But we have to look at our system as well. There's no doubt about it. We can't just be sitting back and saying, oh, well, the World Health Organization said this or that. We have to be able to take care of ourselves. And that leads to another issue as well, Steve, is our supply chain. It is beyond my imagination, and especially as someone who served in Iraq as a surgeon in combat support hospital, the very notion to think that we're relying on someone like China for what we need for our medicines, for our masks, for our protective equipment, that has got to change. And we are aware of that on so many other issues, but we were asleep at the switch on that. That's got to change, not only for our military, but for our society in general. And I'm glad that we've seen manufacturing coming back to the United States. I'm proud of how so many companies have retooled themselves to try and help in this crisis. But let that not be a sudden thing that just comes up, but something that we're prepared for from the get-go before something even happens.
I hear a lot about manufacturing coming back to the United States, but it's still a very small number in terms of what's returned. What do you think would be required? I mean, if you take, I mean, the issue that you talked about, supply chains and the active agent in pharmaceutical drugs, so much of it is based in China, not in the United States. And there are lots of other industries that have this strategic dependency on China's production capacity. To rip all that out and to kind of plant it, if you will, in the U.S. or in friendly countries that we're not having trade battles with, that's a Herculean task. I'm just interested in whether you're hearing anything serious on that front, because it seems like a massive load to deal with.
Oh, it is Herculean, as you said. There's no doubt about it. It's a massive load because really what's taken place has happened over 50 years or so. And I think there was probably the attitude, and I think there's a lot to be said for this. Well, if you're trading with someone, they're not likely to become an enemy of yours, but that isn't always the case. And I think that we realize that now. Our eyes are open to a lot of things, and it's not something that we can just switch overnight. So we've got to be cautious and careful, and it is hard to change that manufacturing and just bring it all back all of a sudden. I don't know that that's a reality, but we have to make a 10, 20-year plan, because if you look at what China's been doing in so many fronts, they've made a multi-year plan. We need to do the same.
I know that you have discussions with your colleagues, other Republican colleagues in particular, about how to approach this, what's going on in their districts. We have a mutual friend, Neil Dunn, a congressman from from Florida, who's been diagnosed with COVID. One, I'm interested in how Neil is doing, and two, what are all you talking about?
Well, it's like we're in committee, but we're not. And it's kind of challenging because you get reports. We'll have a meeting with the various secretaries. And by the way, Neil is doing well. He was on the last couple of calls that we've been on, and everyone wished him well. As far as I know, every member that has gotten this is doing well. But thank you for asking. That's kind. So it's a very challenging situation. We're so used to being able to get together with each other and have conversations, and it's more one at a time. And so there's a time to come back to D.C., and it looks like some of us will be going back in the next couple of days.
When it comes to the stimulus packages, and I think you've talked a little bit about the fourth wave and what would be needed, what is your critique, if you were to offer it, of what you folks have done now, both of what the Democratic and Republican leaders have put together? What's missing in that you think should be part of it?
Well, one thing is it's never fast enough, but it has been faster than previous situations like this as far as getting things rolled out. And the intent is to get money into the hands of the American people and to allow employers to keep their employees, and the employees and everyone to be able to pay their bills is the goal, and get us through this in a temporary basis. We're finding glitches in what we've done and trying to work through those and maybe make some corrections. For a key example is the Paycheck Protection Plan. That right there is a big one, and I think we're going to pass that pretty easily. That component of it has good bipartisan support to get more money into that fund, and that's the type of stuff we've been talking about, as well as talking about the spread of the disease, the protective equipment, what manufacturers are doing what. So it's a long day, actually, and it's a little bit tougher through conference calls and one-on-one is a little better, but that's not how a lot of these can be done. We have the whole body engaged.
Brad, just in our last minute, a lot of folks have been watching this, and it's both people who are policy junkies like me, but lay people as well, who want to have an idea of what they can do, where can they fit into this equation. And I'd be interested in your insights. You're in Ohio right now, and you're not in Congress, but you're in your community. What are you telling people?
Well, one, I'm saying let's get better together is one thing. And so, again, going back to the plasma, that's a great thing people can do. People following the rules, maintaining the social distance, that's important, because when we start seeing fewer and fewer cases, that's when we're going to be able to get back to work. But you know what? Everybody has a personal responsibility. My wife, God bless her, she's teaching kindergarten now, whether she planned on it or not. And everybody has got to protect their family and stay calm during the chaos, and we'll get through this together. Be kind to one another and make sure your neighbors are okay and your family's okay. These are the things that are important for us to get through. And time will help, as well as advances as we come up with antivirals, use the convalescent plasma, and hopefully before too long, we'll have a vaccine so that people that have never got this will never get it.
Well, we'll leave it there today. Congressman Brad Wenstrup, thank you so much. And thank you to all of you for joining me for the Hill's Coronavirus Report. Be well, and we'll see you tomorrow.